Hey, it's Dr. Walter Salubro from Back to Health Chiropractic Center. I'm a chiropractor in Vaughan and also the chiropractor who wrote this book, Back to Health by Choice, How to Relieve Pain, Conquer Stress, and Supercharge Your Health the Chiropractic Way. And today I want to provide a lot of value for you in this video by answering some specific questions about back pain that I received on Facebook this week. And also I want to share some research to back up my answering of this question, and also afterwards, so keep up watching the video till the end, because I want to share with you an actual real case study with a patient to give an experience on how chiropractic has helped someone with back pain. So here's this question that I received this week. It's an interesting question. It says, I have had 3 operations on my back, levels L5 to S1. I take really strong meds for it for the last 20 plus years. Anything you can do for it. Now, I can really sense the reaching out for a solution in this question. I mean, 20 plus years of back pain after 3 surgeries and also taking strong medications, which you all know, medications, they may relieve the symptom, maybe. I mean, in 20 years it hasn't relieved any symptoms or resolved the symptoms, but it never corrects the underlying cause of the problem. I mean, all of us know that. So whenever I think of someone that's been through back surgeries and still has persisting low back pain, something that comes to mind is this condition that's been labeled failed back surgery syndrome. That's failed back surgery syndrome. And I want to share with you some research that I read, this review from the Journal of Pain Research that kind of gives some insight about people that have had surgeries for their low back but still are suffering with back pain, which is kind of, I think very unsettling, especially if you've been through 1, 2, 3 surgeries for your low back and you're still having debilitating pain and having to resort to medications that are not really resolving it. So it's really important to understand what's going on and possibilities for care for relieving the pain, or also even correcting potentially correcting underlying problems, and alternatives to surgeries and medications. So let me read some excerpts from this review article from the Journal of Pain Research 2016. Authors are Baber and Ardek, and they're both from the Division of Pain Medicine, Department of Anesthesiology and Critical Care Medicine, Johns Hopkins University School of Medicine in Baltimore, Maryland. And in the abstract right away it says, the treatment of failed back syndrome can be equally challenging to surgeons, pain specialists, and primary care providers, which is true. Someone that's had back pain after surgery, there's lots going on in there in the structures of the spine that require attention, and sometimes the progress may not be favorable progress that the patient or the doctor or the therapist would really like. And just to give you an idea, this is a model of the spine, low back, that is lumbar spine. So there's 5 vertebrae, in between are discs, and usually if there's surgery in the low back, it may require one of these discs that were removed. It's called discectomy. Possibly part of the vertebra in the back, it's called the lamina, was removed. It's called a laminectomy. Or there may even be fusion, surgical fusion with surgical metals and pins and screws and so forth and plates to keep things in place. Those are some examples of surgery. And don't get me wrong, there are times when surgery is required. And usually it's some cases, and that's why I tell my patients, patients come in and say, should I do surgery? Well, you can always get a surgical consultation, absolutely. But things that I would say that require surgery is if you lose control of your bladder or bowel functions, that's obviously a serious neurologic problem. If there's shrinking of muscles in the lower legs, there's neurologic deficit there, severe neurologic symptoms, shooting pain down both legs, numbness around the buttocks area or the inner thigh area. It's called saddle anesthesia. These are red flags that require immediate surgical consultations or interventions. But a lot of times people have chronic back pain for a lot of different reasons, and maybe jumping to surgery might be too soon. So let me go over a bit more of what this review article says about failed back surgery syndrome. It's been defined as this. So it says, the International Association for the Study of Pain defines failed back surgery syndrome as lumbar spinal pain of unknown origin, either persisting despite surgical intervention or appearing after surgical intervention for spinal pain originally in the same topographical location. Okay? And it's interesting because It goes on to say that patients with failed back surgery syndrome usually have chronic long-standing back pain, and they may be a referral into the legs or not, but they usually have chronic long-standing back pain, and they may have gone through either 1, 2, or 3 surgeries, just like this fellow that asked the question. And it's also challenging for failed back surgery conditions to be treated, whether it's treated with conventional medical approaches, therapies, or even conservative approaches. That's what it goes on to say in this section here. One other part of this review article, it says that the cause or the origin of failed back surgery syndrome can be multifactorial. So the reason why it doesn't respond very well can be for a variety of many reasons. And it can be because the spine is degenerating in that area where the fusion is. It can be because the segments above and below the surgery. So if there's surgery, here's L5, here is S1. So if this has been surgically locked up or fused, well, now the segments up here have to compensate. The pelvis region has to compensate, and that can cause pain in those structures, stresses in those structures. Over time, excessive stresses in those spinal structure can cause degeneration, wear and tear. That's what this looks like over here. So here's a normal vertebral segment with a disc in between, nice and smooth, that's normal, but then eventually leads into degeneration. So this is the degeneration model. This is advanced degeneration, roughed up bones, decreased disc spaces, pressure on the nervous system. So those can be some reasons of why pain comes on after surgery in the low back. Now, what this research article goes on to say is give some suggestions for management. And it's interesting because they do mention conservative management. So physical therapy and medication management are the cornerstone of first-line management of failed back surgery syndrome. Now, I know they don't mention chiropractic in here, but chiropractic falls into that conservative category for pain management and care for these conditions. So chiropractic will fit into the category of conservative management. So physical therapy, I plug in chiropractic into that. Medication may have some uses as well. It says are the cornerstone of first-line management of failed back surgery syndrome. So things like therapies like physical therapy, rehab, chiropractic, they can help the patient optimize their walking patterns, their posture, can improve muscle strength, stability, mobility in the lower back, and also overall function of the lower back. I'll give you a case study on this in a short while. And of course, interesting, it also goes on to say that other conservative approaches involve using perhaps some type of psychotherapy to manage the person's stress, and also cognitive behavioral therapy so they can adapt better with their situation. Okay, so interesting. And when it talks about pharmacological management, this is interesting. Pharmacological, obviously the use of drugs. You know, it's people that are in chronic pain are taking drugs. I get that. They want to cope with their pain and have some level of function in their life. So they do talk about the drugs such as non-steroidal anti-inflammatory drugs, oral steroids, antidepressants, probably because they want to try to feel better with their situation, and opioids. I'll talk about opioids in a moment. But this fellow here, he said he's been taking strong medications for 20 plus years. Well, where did it get him? He still has the same level of pain. Where is it getting him? And that's the same with any other person with back pain, chronic back pain, taking meds for years, or someone that's had surgery and has back pain and taking meds for years. It doesn't resolve the problem. So other approaches are necessary. Now, interesting about what the article says about opioids, it says that because opioids are drugs like OxyContin, Percocet, the fentanyl, morphine. These are all the opioid classes of drugs. They're narcotic drugs, they're pain relievers, and they're highly addictive. And they've been used often in chronic pain conditions. So it says here, chronic pain use is associated with chronic opioid use, that's chronic opioid use, is associated with a multitude of side effects, including immunosuppression, which means depressed immune system. Androgen deficiency begins to alter the hormonal systems, constipation, and depression. Chronic opioid therapy for non-cancer pain is associated with an increased morbidity, so more health problems, and mortality, death rate, and does not reliably improve long-term pain and function scores. So it's interesting that even though opioids are overly prescribed and overly used in our society these days, that it's recommending that it may not actually be useful to help someone with back pain, chronic back pain, or someone that has back pain post-surgery. And then they go on to provide other conservative and conventional ways to manage someone with failed back surgery syndrome or back pain after they've had 1, 2, or 3 surgeries. Now, let me give you the chiropractic perspective. As a chiropractor, what I would recommend to this person that asked this question is certainly get a chiropractic consultation, and the purpose for that would be to assess your current spinal alignment, current spinal function, any level of damage, degeneration, and any potential for improving spinal issues, alignment issues, functional mobility of the spine, stability of the spine. Because I truly believe, even if it's at the bare minimum of helping relieve pain without use of drugs or minimizing the use of drugs, chiropractic is beneficial for that. Improving mobility, beneficial. Improving posture, beneficial. Relieving muscle spasms, inflammation, highly beneficial. So I would highly recommend some kind of chiropractic, at least an exam, and then see what kind of care is warranted from that. And then, of course, exercises, stability exercises, possibly even soft tissue therapy, break down scar tissue would be very, very helpful as well. So that's a short review on failed back surgery syndrome and some options that can be done about it and how chiropractic can play a role for that. I want to actually share with you an actual real case study, a patient of mine. This patient came into my office earlier this year, and she spent maybe 8 or 10 months in physical therapy, was taking drugs, went to get a surgical consultation. She had low back pain, had right leg pain, severe pain in the gluteal buttock area. She lost time from work, very, very difficult walking patterns, difficulty bending to tie her shoelaces, getting dressed in the morning, and obviously very unhappy with that overall condition because it affected her quality of life. So even though surgery was recommended to her, she said, you know what, let me just see if I could continue treating this without surgery. Otherwise, that's my last resort. So she came into our office, and I took a history consultation, did some new x-rays. Her spine was shifted to one direction, putting a lot of pressure in the lower back region, degeneration in the lower back. She also has a history of disc herniations, disc bulges, and damage to the discs of the lumbar spine, lower lumbar spine, which contributed to some of her problems. And we approached it with chiropractic adjustments, and we started seeing her 3 times a week, and eventually twice a week, and then eventually once a week. And over the course of 2 to 3 months, she went from severe pain levels to down to instead of 8 to 9, 10 levels of pain, she went down to 2, 3 out of 10 levels of pain, and taking a lot less medications, and also walking better, better mobility in the low back, better stability in the low back. No more leg pain and thigh pain, some residual pain in the buttock region, and when I showed her post x-rays, the actual alignment of the spine actually improved as well, which means now there's a lot less stress in the lower lumbar region and more stability. So she did really, really well with chiropractic care and totally avoided surgery. Now, because she has a lot of damage in there, she does require maintenance management of her spine, and now we see her, anywhere from once a week to once every 2 weeks for maintenance. But that's way, way better than having to go through surgery and potentially actually having failed back surgery syndrome. So I know that was a long video, and there was a lot of information in there. But the take-home points are that chronic back pain is a serious problem. Drugs may not always be the answer. They may relieve the pain, but may not always be the answer. And surgery is warranted in some medical emergency situations. However, there's a high risk for repeated back pain after surgery. So I would certainly recommend, just like the article recommended, is definitely exhaust all conservative options before surgery and leave that for last resort. Hope you found that useful, and I'll see you again on the next video.